Welcome. Today's topic promised to be exciting. My name is Osawaru. Welcome to Smart Health Network. Today's topic is drugs that can affect your libido or drugs that can cause a man to become a 2 minutes man. We have a list of drugs. Remember, this is a series. This is the third phase of this topic. We have been discussing hormonal boosters. Are they scam or do they really work? We've been able to establish that largely they don't work, especially when the client has a problem. When the testosterone is really low, we find studies have shown that hormonal boosters they sell online don't really work significantly. They don't work. So largely, from my own perspective and from data that are valuable, they are majorly scam. So if you are spending your money on the drugs, hoping that it will boost your testosterone or your libido, it's going to you are wasting your money. Okay, that's why we are live today. However, we found study also found that some of the drugs they advertise also causes a lot of problems than the good. If you go to TikTok today, just type hair loss, you will see they are advertising drugs that could be used to treat hair loss. And some of those drugs, studies have shown that it also reduces your testosterone. Okay, that's why this topic are here today. Medication that can turn you to a 2 minutes man. Those drugs. So number one, let's dive in. You don't have much time to waste. Let's dive in. All right. Number one on that list is hormonal medication. If a man is on hormonal medication, certainly it's going to lower his libido, especially if he take the drugs meant for his wife. We have seen that most footballers have been banned because they mistakenly take their wife's birth control. The reason for that is it does lower your testosterone level. Hormonal therapy, those oral contraceptive pills they give to women. If a man take it, it will lower his testosterone level. Okay. Another drugs is antidepressants. We know that people who have depression or who are battling with some mental health issues will be given some antidepressant drugs. Example of those drugs: citalopram, sertraline, fluoxetine. They are drugs that are very effective in treating treating depression. They're antidepressant, but the side effect is it lowers your sex drive. So if you are a man and you are on this drug and you are wondering why am I not being active like I used to, all right, you need to speak with your doctor. Some of those drugs you are taking could be the cause why your sex drive is low, why you become a 2 minutes man. Okay, you need to speak to your doctor about it. You need to let them review your drugs instead of going online to buy testosterone boosters. I suggest that you see your doctor and then because you have listened to this video, you already know that some of the drugs we take to cure certain illnesses may also have side effects to affect another aspect of our lives. Okay, that's why you need to speak with your doctor. Then complain of what you are now experiencing. Oh, I'm now experiencing low sex drive. I'm becoming a 2 minutes man. Then the doctor will will see what you are complaining and then see what can be done by reviewing your drugs. Okay. Another drugs on the list is blood pressure medication. Blood pressure medication. I know this may sound different from what we already know. Most blood pressure medication usually has side effects to lower your sex drive. That's why most of the drugs like beta blockers, propranolol. If a young man has hypertension, the doctor usually will consider your age, consider your productivity, consider what you are doing currently. Then it will prescribe drugs. That is why in Smart Health Network we keep advising: do not take the drugs that are meant for another person, because there are a lot of consideration the doctor has to consider before prescribing a drug for you. There are some drugs, as we have mentioned, blood pressure medication, that the side effects of the drugs will not be good enough for your health, based on your current age, your size, your weight, your gender, and all of that. That is what doctor will put into consideration. A 70 or 75 years old man can come and doctor say, okay, go and take beta blocker, propranolol, atenolol. And a 25 or 30 years old man, the doctor will say, no, you don't need to take propranolol. Take this instead. What the doctor have done is to put your age into consideration and then prescribe drugs that will also be very effective for you. The reason we have found out now is some blood pressure medication, especially the beta blocker, propranolol, atenolol, all the law in blood antihypertensive drugs, do have side effects of lowering your libido. So if you are 30 years and you are battling with hypertension and doctor is prescribing drugs for you, you should know why it's not telling you to take certain drugs and telling you to take certain drugs. And that also proves a point that you don't need to take drugs prescribed for another person just because both of you have the same illness. Yeah. Oh, you have hypertension. Yes. I also have hypertension. I've been battling my own for about 5 years now. Then you now say, what drug are you taking? Okay. No, brothers and sisters, that's not how to do it. See a doctor. Let the doctor review you based on your age, based on your size, based on what you are doing, based on how active you are. Those are what the doctor will put into consideration and prescribe drugs for. They will also do some laboratory investigation. Know if your potassium level is okay, your sodium level is okay. He will prescribe drugs for you. Diuretics also fall into this category. Diuretics do lower your sex drive. That shouldn't come as a new story, because if a man is always going every 5 minutes, every 10 minutes, going to urinate, there's no way he's going to have libido after all. Because if you are to have a sexual intercourse, or we call it coitus, with your wife, urine should be the last thing that should be happening to you. And now, if you are going to urinate, certainly your sex drive will be low. And that also goes into, if your doctor want to prescribe a diuretics, he has to put all of this into consideration. He will also do laboratory investigation to know, okay, what kind of drugs should I prescribe based on his age, based on his size, based on what he's doing, how active and productive he is currently. Some people could be prescribed spironolactone. These are potassium sparing diuretics. Okay, these are others could be on furosemide. These are sodium sparing diuretics. That what I'm saying is all these drugs are not the same. Patients that take it are not the same. So don't take the one meant for your wife because it's your wife. Oh, what should I take? Oh, no. You must see a doctor who will do some specific tests specific to you. Then they make prescription. All right. Then the next one is finasteride and dutasteride. The reason why this fall is on this discussion today is these are drugs that we see them advertising on TikTok that it does cure baldness. Now let's break it down. They have linked baldness to low testosterone. Studies have shown that this drug also they are using to increase your hair growth and regenerate your hair loss. For some people, it does result to low sex drive, the low testosterone also. So it's not about going around taking drugs. If you have a problem, do the right thing. Go for checkup, seek doctor. So far, we have been able to establish that most of the drugs we take are also not good. That is to say, although they are doing what they ought to have done, they may also result to bring another side effect, which the drugs or the doctor prescribing may not intend you to have. That is why when you now have all of this, speak with your doctor. We are not saying stop the drugs. I'm not saying stop the drug immediately. Immediately you find out that, oh, the drug doctor prescribed for you is making you a 2-minute man. You have to stop the drug. No, you have to see the doctor, and then the doctor will now do the necessary check and then make the necessary adjustment. We will go to that. We will talk about the solutions, but that's just a snippet of what can be done. Let's proceed to the biggest of them all, the opioids and the painkillers. Ladies and gentlemen, these are drugs that we take in order to enhance our sex drive. Most people do take these opioids in order to enhance their sexual performance. Studies have shown that this drug also do reduce your sex drive, do affect your testosterone level also. We all know the drugs we are talking about. People take a lot of drugs back home. In all part of the world, we try to advise them drug is not good. And as they continue on taking this drug in order to enhance their performance, also, they are having the same side effect they are trying to cure. I've seen some people saying they're going to meet out, they are taking tramadol, some are taking oromorph, a lot of opioids, a lot of painkiller, ibuprofen, all of that, they abuse it. That is an abuse. If you don't have any reason to take it, don't take it. Even in developed society like in the UK, they prescribe it most time, PRON. That means it's only when necessary you can take these drugs. Don't abuse it by saying, okay, you want to take it to enhance your performance. It will then worsen it. Look at it. If you have taken it before, you see that in another time, if you did not take it, you're not going to have the performance. Then you begin to say, okay, you need to take it. It leads to dependency and the side effect become worse. That is why we are saying at Smart Health Network that taking drugs indiscriminately is not good for your health and you should not do it. And if you do feel that you are not well and you need management, go see the doctor. And we also said on this channel every time that you may be all right. You still need to do checkup to understand what you could be passing through, to understand, to know what could be wrong, even without presenting with complaints at the moment. Because we have seen people who go to sleep and they wake and they don't wake up. People are going to work and they slump and die. All this boils down to if they have gone for checkup at regular interval, existing illnesses will be found. What could be their problem could be found. We have seen a report of people who randomly go to the hospital and find out that they have kidney failure. People who collapse and then they find out that they have long-standing myocardial infarction and heart failure. liver failure, and the rest. So you don't need to start coughing before you know that, oh, let me go and do chest X-ray to check my chest. Could I be having a capitation in my lungs? These are very important aspects. The reason why we are saying all of this is it boils down to your ability to make wealth, your ability to make money and create wealth largely depends on how healthy you are. If you are healthy, you will have enough time, you will save enough money, and then you will be able to invest those time and energy and money to creating wealth. So we continue. In all of this, what are the solutions to this problem? The first solution is you need to talk to your doctor. You need to talk to your doctor. You need to go for checkup. You need to talk to your doctor. We have said earlier that you don't need to stop the drugs because the drugs is giving you side effects that we have mentioned. It's turning you to 2 minutes man. You stop, you need to see your doctor and explain what you are passing through at the moment, which wasn't there initially. Then doctor will review and then do the necessary improvement and review of your drugs. Okay. The next thing is you need to see a therapist. You need to see sex therapists. We have said it over and over on this channel that seeing a sex therapy is vital, especially when you are having sex-related issues. See a sex therapy. Okay. Number 3 is discuss with your partner. Have a discussion with your partner on the issue you are facing so that you will know the scope. The reason why we are also saying discuss with your partner, we have seen people who are on antipsychotic drugs because one of the drugs that could make a man become 2 minutes man is antipsychotic drug. Okay, that comes in number 6 or number 7. Antipsychotic drugs do make a man become 2 minutes man. It has the side effect. Example of those drugs is risperidone, lazepine. So some people I've seen some people who are on this drug for years before they got married, and they never discuss with their wives, with their prospective wives, with their fiancé, as they call it, that, oh, look at, I'm on this drug. And before now, I've seen that I cannot really perform. It's not that I cannot father a child. We are not talking about infertility. We are talking about performance. The fact that you are not performing does not mean you cannot father a child. They are totally different. You don't need 5 minutes. You don't even need 2 minutes to get your wife pregnant, okay? All you need is let your sperm count be active and the woman be fertile. That's all. Okay, we have seen a case whereby they did not even put it inside. They use it to rub the surrounding, and the woman is pregnant. And DNA shows that is the man that owns it. So we are not talking about infertility. Okay, what we are talking about is performance. Now, the man has been on antipsychotic drugs for a long time, and he knows that his performance is really poor. He has seen doctor have done the necessary review, yet his performance is really poor. But he didn't discuss with his prospective wife. Now they are married. The woman is having issues with, oh, he cannot perform. He's a 2 minutes man. He's looking for solution everywhere. But there's no solution in there because you need that drugs to be okay, to be really active, to be able to make wealth, right? But he has also gone to see doctor over time. They've reviewed the drugs, they've made adjustment and all of that. But all that would have solved this problem was if he had discussed with his prospective wife or his current wife to say, okay, this is the issue that I have. This is why this is so. And this is I've always been how it is, okay? That is why as a husband or a boyfriend or prospective wife, you must discuss with her that this is the issue, okay? And then we'll be able to get an understanding of the scope of the problem. If it's something you can accommodate, can understand with you, then he knows that she knows what she's going into. All right, he can follow you to see the sex therapy or to see the doctor so that both of you can go through all the discussion that is necessary for the home to be balanced. All right, that is it. The next thing is lifestyle adjustment. Okay, if these drugs are not drugs you can stop, like the necessary ones, you need to do lifestyle adjustment. Then some drugs that you can stop, like opioid, like people who are highly dependent on drugs that are not prescribed, that you don't need to be able to be active and make wealth. Stop it. That's one of the lifestyle adjustment. Why are you taking that alcohol? Was alcohol necessary for your cell to function properly? You can stop it. That lifestyle adjustment. Why are you smoking? Is it prescribed by the doctor that you need to smoke to be alive, to be active? You can stop it. All right. Then you need to have a good sleep, 6 to 8 hours every day. Will help to energize your system. Okay. All right. Then the almighty lifestyle changes. Exercise. We cannot overstress how important exercise is. We have always discussed it in Smart Health Network that exercise is an integral part of life, especially when you are between the age of 25 to 55. You must be actively participate in exercise. Exercise is what gives you the strength to continue every day to hustle and make money and create wealth. If you don't do exercise, your system is going to be weak. The reason why we also continue to preach exercise is it gives you the routine you are able to maintain within these years of your active financial year is going to follow you to when you are in the returning phase of life. Returning phase most times starts from 65, 55, or sometimes 60. That time you are not getting return on your investments. You are not doing charity. You are not staying at home doing what you are passionate about, giving back to the society, doing politics, becoming board executive, becoming chairman of companies. That time you no longer work with muscles. You are not working with brain. But your muscles still need to be active. That's why if you create a routine within these 25 years to 55 years of your life, that routine will then be useful when you become elderly. And that time the society needs you more for your experience, your exposure, to be able to guide the young ones to the right path as time goes on. So that is what it is. Routine that you are able to get. You are able to, okay, every week I'm going to exercise 6 hours every week. Keep it going. If you are able to do it 5 years, 10 years, 20 years, 30 years, it becomes part of your life. That when you grow old also, you still continue to say, okay, I want to go for that run. Because at this time, you are not as active as you have always been after all. But you need your exercise to keep you active and continue to get return. We have seen people who retire after 5 years, they are gone, dead. The reason is because they are no longer active as they always be. They no longer wake up 6 o'clock every morning to run to work. They feel tired and weak. Their system begin to become weak and all of that. That is the major reason. If they have a routine that have always been going well for them, at this time they will be able to put it into good use of keeping them alive. I've seen people who left the village, come to the city, stay at home. After 2 years, 3 years, they are dead. If you go check why they are not dead for no reason, it's because when they were in the village, they were active. Doing early morning, they run to work to the farm. They come back at night, they are healthy and active. But now they are in the city, sitting down one place, no activity. That is what we are saying. If you create a routine within your active years, that routine is definitely going to follow you to your returning phase of life. Then you'll be able to enjoy what you have labored for. Because there's no way you are going to enjoy when you are hustling. When you're supposed to be hustling, is it when you will be at home resting? No, at this age, you are always at work. Even when you are not at work, at home, you are working. Like right now, I'm not at work, I'm at home. I'm still talking, I'm writing script, I'm researching about the topic, I'm doing work. I'm not resting. It's the same way. When you grow old, you now have more time to rest, no work. But if you don't have routine, you can fall into the traps that many are fall into to become weak. Their system become weak. Hypertension they don't have before will begin to crop in. They begin to gain more weight. That is why we are hammering on doing exercise. Thank you for listening. Until I come your way next time, remain healthy, be active. Remember, anything that is not prescribed by the doctor, you shouldn't be taking it except it's food. And in that food, there's also a standard to it. It must be balanced diet. If you don't know how to make a balanced diet, kindly consult a dietitian who will help you. Because on this channel also, we have also discussed there are different type of meal specific to different type of individual. If what you are eating is not giving you the necessary nutrients, you need a change. And stay away from drugs, alcohol, and smoking. These are habits that destroy your ability to earn and to make wealth. Stay healthy, stay focused. My name remains Osawaro. This is Smart Health Network.